Right now in our area, about a quarter of the COVID cases are from a new subvariant of the Omicron variant. So what's our community status during festival season? Meg Ferris takes a look.
A lot of people are talking and posting and wondering, did being around the nearly 500,000 people who went to the Jazz Fest spread COVID? So let's get hard data. According to the City Health Department, wastewater samples indicate increases in the Quarter, Little Woods, and St. Roch areas. LSU Health Infectious Disease Specialist Dr. Fred Lopez says this about the numbers.
If you look at Orleans and now St. Bernard and Plaquemines parishes, they're at high levels of community transmission.
But the good news, all 6 LCMC hospitals are at the lowest number of COVID patients since the pandemic began.
We were in the single digits at LCMC Health. We went up to just over a dozen, and we're back today in the single digits again.
Do you think the low hospitalizations has to do with the natural and vaccinated immunity that we have in our community?
Absolutely.
Now, while neither having COVID in the past or being vaccinated will prevent you completely from catching the current Omicron subvariant that's circulating, they do work at what's most important.
So far, data suggests that the vaccines are good at preventing serious illnesses, hospitalizations, deaths. They seem to be very effective at doing that.
And now, the antiviral medications you take at home to keep you from getting very sick are more available. Numbers may be higher than we know because at-home positive tests are not being reported. We do know that catching COVID in an outdoor setting is very low. Mardi Gras was not a super spreader. But we know that the current Omicron subvariants are much more infectious or likely to spread than the previous strains.
But if you're not vaccinated and you haven't been infected and you're completely non-immune, these variants are so transmissible that if you're anywhere near someone who's infected with them, you're likely to get infected.
So being up to date on your vaccines and both boosters is what's recommended. Meg Ferris, Eyewitness News.
Well, doctors say the best time to take an at-home COVID test for COVID is 4 to 5 days after you've been exposed, but some people may not show up as positive until 10 to 14 days afterwards.